Welcome, this is your life now, a wasteland where we all take a vow.
Hi there, my name is Mallory, and I've had multiple sclerosis for 20 years and have utilized a power wheelchair for 13. And I share what my family's experience is like navigating a chronic illness. So today I want to talk about all the doctors, all the diagnoses, and all the prescriptions, how all that works together. But also how I'm either not managing it well, and some things I've done to take off some of the weight and pressure of navigating these things nonstop. So anyways, we're gonna dive in, but first I have a few wins. Like, I totally did like some normal things yesterday, and it was so freaking awesome. I remember driving home just thinking like, wow, that was pretty cool. Like, I feel like normal in a sense, but in the state of Texas right now, it is in the hundreds, triple digits. Is second week of August, right? And it's so humid. So, as you can imagine, managing the heat intolerance right now is a beast. And regardless of being indoors or being in the air condition, you still feel the weight of the heat and the humidity. Like, my body is still impacted by it. So anyways, I did it. I pulled it off. I went shopping yesterday and parked in between like stores that I knew I'd want to go into too, and that way I didn't have to transfer so much into my driver's seat. I didn't take a nap. However, that would have been a really good idea if I could pull that off. But like, I sat in my car for 30 minutes and had something cold to drink and ate some snacks, just kind of chilled in between stops. And anyways, it was cool. I pulled it off. Got a new dress and a new bra. That's a win, right? But at the end of the day, it's not always the easiest thing to achieve, but I did it. So if anything, you heard about my wins today. But anyways, let's dive in. So with multiple sclerosis, it is a autoimmune disorder that is neurological, and so I am treated by a neurologist first and foremost, and that is something that I am beyond blessed to be in a large metroplex in Dallas-Fort Worth area, and so I am blessed to have a wonderful neurological team with the MS clinic at UT Southwestern. And I haven't always been with them, but I have been with them, I believe, at least a decade now. But anyway, and I have a nurse practitioner that I've followed a little bit throughout her career. So it's something that we do have that personal connection, and I feel like she's looking out for me alongside with my physician. So anyways, of course, with multiple sclerosis, and I can assume comfortably that with a lot of chronic illnesses is the right word, but I can imagine that it is quite the journey to navigate all the physicians and what goes along with that. But with multiple sclerosis, of course, you're being treated with your disease modifying therapy and whatever else is necessary, but it seems like everything in the pharmacy world has side effects. You guys listen to commercials, right? Like, everything's got pretty poor side effects, some of them worse than the actual ailment. But anyways, that's a lot of what I also have to be treated for. And so anyways, my neurologist treats me for my multiple sclerosis, of course, but additionally, muscle tightness and spasms, insomnia, nerve pain, and any other pain, lack of or enhanced whatever, coordination, migraines, fatigue. Those are, for the most part, all umbrellaed under my neurologist. And I will say, you know, in my past 20 years, this I've only felt like in 2024 and 2025 that specialists have ultimately become a lot more narrow. Like they only want to treat in their modality, and even if I mention something that fits another specialist, it's sort of like, oh, you want a referral for that? Let me send that in for you. And so it feels more checkboxy in the recent years. And if anything, just the way 2025 has felt, I think that is really driven by the industry as a whole. Especially since I've worked in the environment, I know all the checks and balances that have to happen in the healthcare industry, and so it's gotten even more challenging for a consumer, a patient like me and you that is just struggling every day just to feel comfortable and have a good quality of life. So, but anyways, my neurology team, they do treat me with my Kesimpta, which is my treatment for multiple sclerosis, and that's a once-a-month injection. And so they're also providing me with like Ambien to help me get some rest, muscle tightness. So I am also receiving muscle relaxers through them. And then steroids. Anytime I have a flare of any sort, or I think I'm spinning into a flare, or just things don't seem right, I'll conversate with my physician. If you're not using your portals, you're losing out, because my chart is like the bomb for a chronically ill individual. It's like my social media. But anyways, I will have those conversations back and forth with my physicians through the portal, just letting them know that, hey, I don't think this is right. Hey, what do you think we should do? And so I get pretty good responses through my providers, through my chart and the portals available. But additionally, they're treating me for pain. I mean, there's likely a usual and customary, like, we're going to prescribe gabapentin, steroids, and etc., muscle relaxers. So anyways, I am on all of those things. Medocarpamol is my muscle relaxer, and then gabapentin is also for the nerve pain. I answer this question a lot too, on how do I know the difference, or what is the difference? Nerve pain equals TV static to me. That's when my TV static feeling fluctuates and increases. I know I've got some nerve stuff going on. But I do take a gabapentin every evening just to tone out the static so I can get some sleep. And then the muscle relaxers too, the medocarpamol, that is, I mean, just really, I know I need it when I can't get my muscles to relax. So my shoulders will be hard as a rock. And this is on top of like stretching and exercise too. So I do have to supplement it with medication when it rains. But also at night, just to get some rest, get a little bit of shut-eye. But I'm also taking Empura for coordination. And I'm going to say for coordination because that is deemed a walking pill. And at the end of the day, I'm not walking. None of that. Not even a step is happening. And I still end up taking the Empura, and I take that regularly, just as prescribed. It's got a very likely side effect of seizures, and so I don't shy away from the appropriate dosage on that, just because I'm scared of having a seizure, which I've never had. Yay. But Empura really helps with coordination as a whole. And if you ever research that medication, yes, there's a lot of side effects, but I've not experienced any of them. It is actually a conductor of sorts. So where our bodies have eaten away at the myelin, Impura comes in and puts this lining around, it puts a lining around that nerve so that the signal can flow seamlessly. And so I just was talking with a gentleman at my support group where he was explaining, he felt like his brain fog was less, his coordination was much better. And so I'm like, yeah, I feel you there. Like, I feel it in the dexterity of my hands and the amount of things I drop and don't drop, etc. But I've tried to take breaks from Impura simply to say and question, like, is this doing anything, or am I wasting my time and money? And at the end of the day, I always find that regardless of my inability to walk, it actually is substantially helping with my coordination. So know that. And then just a friendly disclaimer, don't take it late. I know you're supposed to take it every 12 hours. However, it does tend to keep me up at night. So I learned to take it before 7 p.m. was really my goal. If I took it before 7, I didn't have any issues. So fun fact, I guess. Hope it helps. But I would also additionally, mostly with weather, that I notice it, suffer from migraines. So I do take sumatriptan when I recognize the onset of a migraine. But here's the problem with that is I'll get to like a situation where I'm like, is this a migraine? And then it's like, well, no, I think it's muscle related. Maybe I should take another muscle relaxer. And oh, maybe it's just a headache. I should just take a Tylenol. And then on the other spectrum of it, after I've stressed myself out and everything's so tense and tight and I start switching, I'm like, oh my God, this is like an eye thing. And so you just kind of end up with a vicious cycle in my case, because you're at a mental battle with yourself on what's really going on internally and what should I do? How should I address this, etc. And then the last medication that my neurology team is managing is modafinil. The name brand is Provigil, just in case you have no idea what I'm talking about. And so that medication is really to support me through fatigue. So if I'm trying to accomplish anything that I really want to get every single detail accounted for or present something with a lot of clarity, I will take that medication. I don't take it consecutively or regularly. So what I mean by that is I might bundle it and take it 1 to 3 days max, and then I'll stop. And the reason being is because it does have, for me, it does have the ability to promote anxiety. Also, it can be a struggle to get some rest after taking that medication. I kind of describe it as taking an upper and then I got to take a downer for Ambien to go to sleep, because I feel like my brain is just ticking. And I also, this is so funny, but I'll confess this to you. But it also is a medication that I find I have to try it out. So whenever, like a speaking engagement, I took it a few days in advance just to kind of get comfortable and with how it makes you feel, because it is rather weird when you are fatigued and tired all the time to then all of a sudden have energy. Like, I almost in a sense start to get on my own nerves because I talk more, I catch more of my surroundings, I retain more. And so I don't know, I start to get kind of worried, like I'm totally getting on other people's nerves at this point, and it's really just medication to help me with fatigue. But again, it sounds wonderful to have that much energy, but you have to also account for the side effects that come along with that. So like I was saying, the insomnia, the anxiety, and then I additionally almost always end up with a migraine if I take it consecutively. So I just have to play very cautiously with that medication. So it happens. But next, so I also am treated by an endocrinologist, and that is because I had my thyroid removed at the end of 2022. And the reason I had that removed is because after Limtrada, that medication just absolutely fried my thyroid, and just really based off all the conversations I've had with physicians throughout UT Southwestern, and it seems like every patient on that medication and part of that research study could and likely is in that same group of thyroid issue team. So anyways, we meaning me and my husband, we elected, once we got it somewhat under control, we elected just to have my thyroid removed. And the reason being is it was our mentality. There was no right or wrong, I don't believe, but our mentality around it was, if we don't take it out, we're always going to be thinking at the back of our mind that whatever I'm feeling, whatever's I'm experiencing, whatever side effect, we're always going to have it in the back of our mind that it's my thyroid acting up or something. And so we just elected to have it removed, and we thought we had a better chance at the end to get my medication under control. And so now, several years later, I still wouldn't have changed that decision to have my thyroid removed, but several years later, though, I'm like, it's still not under control. I am so sensitive to the medications that every month I will do lab work, and they'll just barely tweak it by a milligram and just add half a pill one day a week, or let's take away. And in fact, just recently we were exploring, well, let's go on generic, or go off generic and go on to name brand. Let's eliminate dyes. Let's see if we can get rid of that. Your thyroid affects a lot. And so it's hard. It's really hard when it's off. Just know that. But it's also having MS at the same time. Like, it's triple the fatigue. It's just the emotions, because it is a hormone. So it just it's quite a bit to navigate. But my endocrinologist, they do manage my levothyroxine. I can't say it. Levothyroxine. I had to look at it and sound it out. But they do manage that very closely. Like I said, almost every month I'm doing lab work and tweaking it in some way, form, or fashion. So we'll see. I will continue down that path until we get close-ish, somewhat, maybe. But so moving on to my third physician, I do see a urologist. And if you're not familiar, MS affects your muscles, it affects your organs, it affects your nerves, it affects everything, absolutely everything. And so I do see a urologist because, if you don't know, your bladder is a muscle, and that was one of my really, like, the first issues outside of optic neuritis that I experienced with MS is bladder issues. And so for me, that was the constant sensation or feeling that I needed to go to the restroom. But then when going to the restroom, I was not able to void and relax those muscles that would allow all the urine to exit. And so what my urologist manages is a quarterly Botox injection. And we're going to get into this one a little more in depth. And the reason why is because it is so popular. Not popular in a good way, but this procedure is the best option for someone that's dealing with the spasticity of a bladder and the incontinence of your urine. And so I want to do a really good job on describing the bladder Botox procedure because I talk about it a lot, surprisingly. So we're going to go in depth on this one. So when you have the Botox procedure done, Botox can be administered every 3 months, textbook wise. And if you were having multiple Botox procedures, so for example, Botox of your bladder, Botox of your legs for muscle spasms, if you're having cosmetic Botox, those are essentially supposed to be bundled and all performed within the same week. Exciting, I know, because none of them are really very comfortable. And so what that might look like is, back to back. So for me, I might have bladder Botox on a Monday and then leg Botox on Wednesday. Like they've got to be bundled. And so I might see 2 physicians all in the same week. I might be uncomfortable twice in the same week. And treat myself to tacos 2 days in 1 week, because that's what you're supposed to do when you've been put into that uncomfortable situation. Anyways, went on a tangent there. But so the bladder Botox, it's actually really quick. It's like 6 minutes tops. It is uncomfortable. It's not fun. But I mean, if your legs are up in stirrups and your vagina is up in the air, every 3 months, it's not fun. So I don't know how you get around that. But how Botox is administered is they clean you. And then additionally, they will, and I really don't know how that part is done. I haven't figured that one out. Maybe I'll ask this next time, but they somehow numb your urethra. That's the long tube that is from your bladder to the exit. So anyways, they will somehow numb your urethra. And then once that's numb, then they will, I guess, inject or insert. I don't know the right word, because they're not injecting your bladder, but they're filling's going to be the word. They fill your bladder with a numbing treatment. And so it helps. You need it. So all the prep, all the ladies do all this prep, including, get me in the stirrups and on a table, and because I'm not mobile, so that's a bit of a challenge. And I always bring my husband because I need somebody to throw me on the table. And additionally, when all of the procedures happening, spasms in my legs and everywhere else flare up because I'm in pain. And so anyways, it's the whole thing. But once the doctor comes in and they actually begin the procedure, they will insert a catheter that is hollow. And for that reason, that's where all the needles get inserted, is through that catheter. And he's looking at a video monitor right to the side of me that's really showing him everything internally that he needs to see. But again, it's 6 minutes tops. It could be a little less. I try to zone it out and squeeze my husband's love handle while they're doing it. 'Cause I mean, the medication is meant to alleviate the pain, but it doesn't eliminate it all. So you do kind of have to just hang on. And sometimes, following, there's no pain following. I mean, it's sometimes a little tender to try to go to the bathroom and things like that. But otherwise, it's worth it. Let me just say that. Though I'll wrap up the bladder Botox thing with, it's worth it. I would choose that little 6-minute bit of pain any day over the nuisance of feeling like I constantly needed to go to the bathroom, or feeling like I'm constantly going to wet myself. And so I'd do it over and over again. But additionally, when you do have that procedure done, it does wear off. And And I mean, you could get anywhere to like 6 months on Botox. I've never made it past 3, and I don't want to, I don't want to go that long at all not having Botox, simply because it's so uncomfortable and annoying. So the in between, I do take a medication to manage the bladder spasms, and I actually had recently just switched from oxybutynin, which is, I understand, an older medication that has a lot of unwanted side effects. I recently switched over to Mybetriq. It's a little more expensive, but the reason I went ahead and pulled the gun and switched, because I could eliminate so many side effects, but I've met all my out-of-pocket. We're already 8 months into the year, so I'm well past meeting my out-of-pocket. So I'm getting medications now at reasonable prices. But so anyways, we'll see how long I can keep that up and stay on my Mybetriq, because it actually really works well. Meaning, like, I have to like keep track of time and know, oh, I haven't gone to the bathroom all day. Should probably go do that. So that's a great medication for me right now. But when you sit all the time, you're just highly prone for UTIs. And so my urologist manages antibiotics for that. And I do take a daily maintenance antibiotic, because if you've got MS, an infection, period. It could be a sinus infection, UTI, a cut on your toe. It could be any of those things, but you're going to have some sort of increased MS activity. Not meaning like lesions and all of that. I mean like the things that you feel every day, like sensations increase, you get emotional. For me, right? This is my case, but you get emotional, coordination. I think coordination really starts to lack for me, where I was able to transfer yesterday, but not today. What kind of infection's going on? And so I struggled very much so with UTIs. But once I started taking a daily maintenance antibiotic, and I take Macrobid, that, and a very high dose of cranberry, which I don't buy. I think there's one that they recommend, but I buy one off Amazon that's got the same milligrams and dosage as that high dollar one that's much cheaper. So little trick. But anyways, you do have to manage all those things with the UTIs. And then when you have bladder Botox, I just talked about all the sensation things and everything calming down. You've essentially, in a sense, kind of paralyzed the bladder at that point with Botox. So I do have to do self-capping. Again, I would never trade any of these things for the latter. It is not as bad as it seems, to get relief and know that I don't have to go to the bathroom. I've emptied my bladder, blah, blah, blah. It's worth it. I strongly suggest it if you're struggling with bladder issues. I know in theory it sounds terrible to have the Botox procedure and additionally self-cath, but gosh, it is so worth it. And of course, my urologist is managing the prescription for the self-cath, as well as managing the amount. So that can fluctuate too, whether you want to go to the bathroom 3 to 4 times a day. And really the urologist will talk you through what is appropriate and safe for you to be emptying your bladder at certain times and so forth. But I had additionally, I most recently talked to my urologist about travel, because it's so hard when we travel. This last time we did a work trip that it was a 9-hour drive, and when I say work, my husband's work trip that we tagged along on. Anyways, it's a 9-hour drive, and so the plan, we had to plan around, well, where do we know there's family bathrooms, and he's got to help me, and anyway, so we found Walmart's to get me to the bathroom and so forth. And so, anyways, we've been talking with the urologist about long-term options. If I just need to get from point A to point B and it's going to take 9 hours, what options do I have? And if I needed to stay cath for even longer period, there's also options for that. So advocate for yourself. Don't be timid on it. They talk urinary tract system all day, every day with lots of patients. So advocate for yourself. There's lots of resources out there to keep you comfortable and have a better quality of life. So, but I cannot advocate enough for the bladder Botox. It's a lifesaver of a lot of stress for me. So if you're scared, I hope this helps and I hope you'll try it. So next is my fourth physician, which is through, I know UT Southwestern calls it PMR, but it's pretty much your rehabilitation department or physical therapy, occupational therapy. So at UT Southwestern, where I'm treated, the physician that I'm seeing there actually treats the muscle spasms. And I've done this procedure. It's been about 8 years since I've done it. And it's simply because I've been able to handle the muscle spasms up until this summer. The heat, for whatever, it just made all my muscles so tight. And I just, at this point, muscle relaxers and hot bath, stretching, exercise. I mean, nothing is getting me any relief right now. So I am revisiting the subject and going back. And so actually coming up next week, this week, a couple days, I'll be having first injection on my legs in quite some time. So this go around, though, I do have lidocaine cream on my treatment plan, which does alleviate a lot of the concern, because this is a procedure, of course, that is not comfortable by any means. It's probably the most uncomfortable thing that I've had to date to manage symptoms, but it's worth it, I think. We'll see how the next 3 months go. I'm giving it a try again, but my first experience, I think I had 2 treatments 8 years ago, and so that would have been over a year's time, or 6 months times, because they'll do it every 3 months, and alongside my bladder Botox. And anyways, so what this procedure entails is inserting a needle into the problem muscle, attaching an electrode to that needle, and shocking continuous, like not just a jolt and then we're done, like a continuous electric shock to manipulate the muscle into spasming and acting as it does every other time you're trying to go to sleep. So, and then once they achieve that spasm is when the Botox is injected. If it was once, like one injection, it might not be that bad. But when you think about all the muscles in your legs that are being addressed, and then additionally this go around, we're going to do my shoulders too, because I'm just struggling to get my shoulders to relax, and it's almost like feeling like you're stressed all the time. I'm like Hulk. Anyways, it's just not, I don't know. Ugh. I hope I have good reports on it, because it's been 8 years. Things have changed, I think. I hope. I'm being optimistic about that. And I have lidocaine this time around, meaning my husband's going to lather me up in lidocaine cream an hour before my appointment, and we're going to hope that helps. And I'm not as big of a wuss as I sound. Anyways, I would never halt a procedure or stop it. I'll tough it out and I'll make it happen and I'll do it, but it's not fun. But we'll see. But that's what the rehabilitation department is doing for me at the moment. But they also they manage wheelchairs at UT Southwestern too. So like I just recently had a wheelchair evaluation, and what that entailed was pretty much just evaluating the things I was complaining about. Like, I don't feel safe anymore. I'm not as comfortable as I feel like I could be. And so we had the wheelchair company come in, and they meet with the physician as well in the rehab department. And they just kind of evaluate your wheelchair and what you're saying, and hopefully coordinate and assist you with getting those things corrected. So in the meantime, I've got wheelchair parts and hopefully new batteries and all that coming. And if you don't know, you are eligible for a new armrest and a seat cushion every 6 months. So utilize your benefits, y'all. Because this is our life. This is an extension of our body. And so I want to stay as comfortable as possible. So utilize your benefits. Okay. But anyways, that's what my 5th physician is managing, and my 6th physician is Gastroenterology. And again, much like I talked about the bladder, internally we've got a lot of muscle operations, but MS patients can suffer with swallowing and the esophagus, moving that food into your stomach, your ability for your stomach to be able to break down the food. And then again, like, what does your intestine do with that? Is the valve opening? Like, all of those things are impacted by the signal, nerve signal, right? But additionally, the muscular movement internally. So over the last couple years, a lot so noticeably after Limtrada and the thyroid stuff, I really started experiencing a lot of issues with what I would describe as sour stomach. I carried around Tums with me all the time, and I really don't know why, because it did nothing. It just, I don't know, it was a substance, I guess. So gastroenterology is helping me to sort of, it's kind of we're still looking, trying to figure it out kind of thing, which part is the issue. But so my gastroenterologist is managing my appetite, nausea, heartburn, stomach pain, constipation, like severe constipation is a thing. They're helping me by managing all of those things. And I really don't have a lot to say about my gastrologist, because there's a lot of unanswered things right now. And I think that if there's anything I could say is, if you don't feel comfortable with your doctor and you're not getting the results you need, start advocate for yourself, right? Push back, get a second opinion. That's okay too. I'm looking at the big picture, and it's really challenging, again, when your specialist is just thinking about their specialty and what they treat and what they've seen in the past. And so again, like, it's just, I don't have much to say on it, because it is one of my biggest struggles, but it's also the specialty that I'm not getting any headway on. And so I'm additionally exploring other physicians and what else could be going on that's affecting all of those things, right? So I don't know, more to come, maybe, hopefully. So my 6th physician is my dermatologist, and this one I keep locally just because, I don't know, in my mind I'm like, I saved myself the drive and overwhelming traffic experience by choosing to keep the other few doctors locally. But I have to see the dermatologist because, I mean, a lot of the medications that we have to take to manage our MS do create so many other issues, and skin is one of those. I'm very blessed to have very good genes. I look much younger than I actually am. My skin looks a lot better than I actually take care of it. So just know that. But my dermatologist is treating psoriasis as well as scalp dermatitis. And so I do take, I do have a cream for the psoriasis. And then I also have a foam. I think that's, it's Zorivi is how you say that, for my scalp. And then also CLN, as in Nancy, shampoo is something that we have to use regularly just to keep my scalp from just constantly itching. But I mean, these medications are harsh. And so it just, I don't know, creates issues on my fair, pale, sensitive skin sometimes. And also creates issues in a sense of moles, skin tags, things like that grow from the medications. I'm likely not explaining any of that right. So just know that. Fact check me before you start like quoting me to doctors. But what I do have to have done regularly is called skin mapping. And what that is a doctor that takes a little microscope and looks at every single mole or imperfection on your skin and then says, yeah, I'm worried about that one. Let's remove that, send it to a lab. And had that done recently here. It's benign, but still they take all precautionary steps to effectively evaluate that. But it is what it is. I do it. But my seventh physician, and at this point we're getting into like the things normal people do, right? But my seventh physician is my gynecologist. I obviously see them for preventative care, regular checkups, but and get your mammograms, friends. But I'm also I do have other issues downstairs because of all the medications too. And so I do have a script for Premarin cream that helps when needed. And so I work with that physician closely on anytime I'm having any discomforts or issues. And if you don't know this about Kesimpta either, which is disease modifying therapy for MS, if you don't know side effects for that, and common side effect but not documented, uncommon when it comes to the medical books, but if you read social media pages and everything else, sinus infections, sinus drainage and all that is a common side effects, and yeast infections. So just heads up, know that for Kesimpta. But anyways, and then I also see a chiropractor, so we are up to 8 now. So I do see my chiropractor every 2 weeks if I can make it happen. And when I say chiropractor is challenging because it's got to be coordinated with my husband, who's able to get me on the table, flip me like a hot dog at 7-Eleven. He's got to be there to do that and help me get to and from. And so it's a quick appointment, gets me comfortable very quickly. But in between, when we're not able to make it there every 2 weeks, in between, a good bear hug does great to get my spine corrected, or just floating in the hot bath is wonderful as well. That keeps me comfortable for a little bit of time too. But I, of course, see the chiropractor in between stretching and exercising and anything else we're doing just to kind of work out my hips or discomfort that I feel. So that almost wraps up all my physicians. Before I bounce over into the last point I wanted to make, I did want to say, outside of the medications that I listed under each modality, I am also, I do take a regular multivitamin, a probiotic, a vitamin D3. I take 10,000 IUs, and that's just based off my lab work. Looks good. And I take that every day. My lab work looks really good right there where it is. And so we leave it be, and I still keep taking 10,000. But given all the doctors that I just mentioned and all the medications that I have to take and all the phone calls with doctors and office staff, pharmacies and third parties that manage the pharmacy, and what else? Financial assistance for all the medications that they won't fill. Anyways, through all of that, I just, over this last season, was so overwhelmed by all the appointments, all the doctors, all the medications, all of the phone calls. Oh my gosh. That I just kind of went full circle. I had been feeling a lot of pressure to find like a governing source, whether that be a functional medicine doctor, just someone that would look at me as a whole, like look at me as if they wanted to treat the big picture and help me to feel as good as I could. And so I toyed around with the idea of going like the functional medicine route, where I would just pay out of pocket. And I just never, I don't know, the more that I thought about it, I just never really felt completely comfortable, because after everything that I just mentioned, there's a lot going on, right? And so breaking away from a healthcare industry and all the checks and balances and licenses and things like that made me a bit nervous. So I never followed through with it and found a functional medicine doctor or made any appointments, because I just was never really comfortable because of those reasons. And so I kind of got to a place where I was like, well, maybe I need to find a PCP. Like my PCP I had not seen in 20 years. And it's just because of every issue or even sinus stuff like would fit into one of my specialists. Like I was able to get every single little thing treated through a specialist, and then if it was like a sprained ankle or something, I'd just go to urgent care, because that's what I would have to do anyways, when the doctor's office is closed on the weekend. And so anyways, I just never had a reason to keep up with the PCP. And so I routed back to that idea and still wasn't comfortable. I was not comfortable at all. Just making an appointment with any primary care physician and knowing that they have so many patients and it's a lot to navigate, and you only get a 30-minute appointment in many cases. And so I'm like, I just wasn't optimistic. I wasn't seeing how it was going to benefit me. And so then I kind of leveled up at some point, and I listened to some folks in my support group, and just for whatever reason, just thought more around the idea of like a concierge primary care physician, and that's where I landed. I do have to pay for it, of course. And the good news is it's quarterly. I can break that down and pay it quarterly. And then that way, like if I don't have anything going on next quarter or don't feel like I need them to support me through that quarter, I can just skip that 3 months. And if I hate it, I can come back it's just, there was a lot of prorated options. But I mean, even just like my first like meet and greet, see if you even want to do this kind of appointment with the doctor, I had 90 minutes to, no, take that back. I had 45 minutes that first appointment just to kind of interview the guy. And that's really how I treated it, as an interview. I was interviewing for him for, what do you believe? What's your focus? What's your priority? How many patients are you managing? Like, it was all those things. Like, I'm going to spend this money, and if I'm going to go out on a limb here, I just want it to be worth it. And I wasn't at all worried about the physician just because I've heard amazing things about him in the community. But also he was my husband's previous primary care physician before he went to this concierge type service. So anyways, we decided to do it just because I just been so overwhelmed these last couple of months. And I mean, even my husband at some point had made the comment about being so sick of insurance companies, and I'm like, what do you mean? I live my life and sit where I'm sitting and do what I'm doing. He's like, that's what I mean. Like, I'm sick of hearing it from the other room. I'm sick of hearing you cry, and fight with these people. And so anyways, my first appointment was a 90-minute appointment, and it really was going through my entire medical record, releasing him to like dig into anything. He gave me 2 additional referrals to other physicians, like Gastroenterology, that he thought, maybe you should get a second opinion. That might help. And helping me get medications. Like, there was a certain drug that one of my specialists was like, yeah, call your doctor, or call your pharmacy, see if they will cover it. And if they do, send me a message. But it was all on me to do the legwork. And when you manage so much, all while exhausted and fatigued and beat up in general, like I was getting run over really, really badly. It was getting challenging. And so anyways, I have had a lot of amazing success with going the route of a concierge physician. And I mean, I'm about a month in on that and been able to take quite a few things off my plate that I would have never imagined I would have been able to accomplish without a physician of this sort. But we'll see. I hope I can continue to keep saying good and positive things about that decision and that route that we took. So, but at the end of the day, that's what we're managing, to make sure I have the best quality of life and feel the best that I can at this current state. But I hope this helps someone. I hope medication, drugs, physicians, I hope all of this at some point, like, I hope it's helping and impacting and driving someone's ability to make a decision and so forth. I just want to help in the end of the day. And so, anyways, thanks for joining.
Thanks for watching. If you're enjoying the content we're creating, please remember to subscribe to us on YouTube, follow us on Facebook, Instagram, and TikTok, and find us wherever you can get your podcasts.